Hi everyone. A simple aspirin can be used for antihypertensive and fibrinolytic agent. So let's see. So today we will be discussing about the topic fibrinolytic agents. So fibrinolytic agents are the agents which will lyse the fibrin. So normally if any damage happens here, von Willebrand's are going to be activated and the fibrinogen is going to be converted in the presence of the thrombin, and there will be insoluble mesh like structure is going to be prepared. So on which the platelets are going to be aggregated on this. So this is how the mesh is going to be formed. Okay. So to inhibit the blood flow, so normally vasoconstriction is going to be take place. So resulting on that is going to be taken. So here first we need to understand the difference between the hemostasis, thrombi and embolism. So though these terms similar, but the function, the property is going to be changed, depends. So hemostasis, say for example hemostasis, so here there is a damage of this epithelium cells that causes the plugging of this particular this is called as hemostasis, which will inhibit the flow of the blood. So that is called as hemostasis. Next, what do you mean by thrombi? Thrombi, if this hemostasis is uncontrollably, is still keep on growing, which inhibiting the normal blood flow. Okay, so maybe some of the other regions. So if it is causing such type of difference is called as thrombi. So here the difference between the hemostasis and thrombi. Thrombi is the enormous growth of this thing. Okay, so here the uncontrollable clot can be formed, which may interfere the blood flow of the vessel. So that decreases the blood vessel, because obviously there is a less volume is there to flow the blood. Okay, this is called as thrombi. Next, coming to embolism. So embolism is much complicated, much dangerous than this thrombi. So here if this thrombi detaches from the surface, okay, so if it is detaches from the surface and it can move in the systemic circulation. Okay, so this phenomenon is called as embolism. So here embolism is comparatively is danger because so it can occlude or block any type of blood vessels. It may be the kidney, it may be liver, brain, heart, coronary artery, whatever it is. So which causes the significant damage at that particular vital organ. So that is the embolism is much complicated than the thrombi and all. So here to treat this, what basic thing is, we need to destroy or dissolve this clot. Okay, we need to dissolve this clot, then only we can this can be treated. So here the agents which will break this clot or thrombi or embolism are said to be the fibrinolytic agents. So fibrinolysis. So normally you know that the here the fibrin is going to be formed by the prothrombin to thrombin, and thrombin in the presence of thrombin, fibrinogen to insoluble fibrin. So fibrin, it is like a thread like structure which is not soluble. So here insoluble fibers. Now our aim is to dissolve or digest this insoluble fibers. Okay, so how we will say that while this clotting formation is there, so in plasma we will have the plasminogen. So the plasmogen is going to be present even in the clot. Okay, so we will denote with the star. Okay, this plasminogen is inactive in nature, but it present in this. So once it is clot is formed, so serum is going to be ooze out, but the thing is all the clotting factors are going to be present in this. Okay, so this is plasminogen. So when the clot want to if you here these epithelium cells are going to be secrete a specific enzyme, okay, tissue plasminogen activator, okay, tissue TPA, in the sense tissue plasminogen activator is going to be secreted by these epithelial cells. that causes the activation of this plasmin. Plasmin in the sense, so which is there in this, or even in the plasmins present in the plasma are going to be get activated. So what this plasmin is going to be do is going to be digest. It will cut the fibrins. Resulting of that, the entire thrombi is going to be get dissolved. So after dissolving these thrombi, so these are going to be engulfed by the macrophages, thereby is going to be cleared off. So if the wound is take place on the superior, so normally a red patch is going to be formed and is going to be detached from the skin. But in case of internal hemorrhage, so this is the process where the plasmin has to digest this and is going to be engulfed by the macrophages. Okay, so normally in plasma there will be have this Plasminogen activator inhibitors. So normally endothelial, so in healthy endothelial cells they will secrete this, so that the plasminogen cannot be activated. But when required, then these are going to be suppressed and the plasmin is going to be prepared. Okay, so here this is basically fibrinolytic agents are going to be basically useful for the individuals who undergo the major surgeries. Okay, after post surgery, so we'll give these medications. So normally these can be classified as TPA activators, tissue plasminogen activators. So example, alteplase, okay, streptokinase, urokinase. So these are said to be the primary and this is said to be secondary drug. So alteplase is worked by initiating or activating this TPA. When TPA is get activated, all the plasminogen is going to be converted to the plasmin and all the plasmin is going to be busy with the digesting these fibrins. So that's how we can decrease the fibrin. Next, streptokinase. Streptokinase, these are the agents isolated from the hemolytic streptococci. So normally the bacteria secretes this particular enzyme to maintain the liquidity around this, so that the growth can be obtained by. So here what we use this property, hemolytic streptococci, we isolate this specific enzyme called as streptokinase. So what it will do, normally it will cleave the fibrin at arginine and valine amino acid. So resulting of that, this fibrin is going to be get detached. Next, urokinase. Urokinase, it is obtained from the human urine. So normally this drug also the break this fibrinogen at arginine and valine. So that's how it's going to be act as a fibrinolytic agents. Normally the enzymes are going to be this urokinase and streptokinase. So these are the enzymes. Normally we will denote in the international units, 1,50,000 international units, and will have the side effects like rashes, nausea, etc. So these are very, very important drug for the post-operative surgery. Post-operative surgery, so we are supposed to treat along with these painkillers, multivitamins. So these drugs should be used. Next we will go for the antiplatelet drugs. Antiplatelet drugs are, so normally, so when this plug is forming, so there will be normally these platelets are going to be present in the serum, so it is not activated. So when there is a damage, these platelets are going to be get activated by normally the when the damages take place, the prostaglandin is going to be synthesized. Arachidonic acid, in the presence of COX enzyme, prostaglandins is going to be synthesized. This prostaglandins is going to be secrete this thromboxane A2, so which will helpful for the aggregation of these platelets. Next, for aggregation you need energy. Here the cyclic AMP is going to be converted to the AMP in the presence of phosphodiesterase enzyme. Next, the GDP is bind to with the P2 Y2 specific enzymes, and there will be a higher production of the fibrinogen is going to be take place by the glycoprotein 2B and 2A. So this is how normally the activation is going to be take place. So here what we do is we will block a specific steps to inhibit the platelet activation or antiplatelet drugs. So first if you see this prostaglandin synthesis inhibitor, so normal aspirin. Okay, this aspirin what it will do, it will inhibit the cyclooxygenase enzyme, so thereby the arachidonic acid cannot produce this thromboxane A2. So when this is not there, so it cannot aggregate the platelets. Next, the phosphodiesterase inhibitors. These are the agents. Example, dipyridamate. So here it will inhibit. So inhibit this specific enzyme. So which will inhibit the conversion of cyclic AMP to AMP. So resulting of that, it cannot further activate. Next, we will go for the ADP inhibitors. Normally clopidogrel, ticagrel, ticlopridine and prasugrel. So normally these are going to be block this ADP to bind to this P2Y12 receptors. That leads inactivation of this. So it will not further secrete this, initiate this glycoprotein 2B and 2A. So or directly we can block this specific receptors, glycoprotein 2B, 2A. Thereby the fibrinogen can be decreased. Example, esekumab and epifibatimide. Okay, so these are the agents normally used, and these are the basic mechanism how the drugs are going to be work as a fibrinolytic agents. Hope this video is useful. Thank you.